Yusuf Tanko is Chairman House Committee on Health, is here with us on Political Update. Thank you for joining us.
Thank you, sir.
Tell us about, first, before we go to the school reopening, about Nigeria's response so far in your oversight, in your interactions with practitioners in the health sector, you being one as well. How have we fared so far? We didn't prepare for this, of course, we didn't know this will come, but how have we fared so far?
Well, overall, general performance, when we say opinions varies. And this is due to actually lack of basic statistics to start with, and the fact that it is also complicated much by economic status of nation world over, because the pandemic itself came up with a phase that affect global economy, and that does not spare Nigeria. But by and large, one will say, if you look at the government intervention, government has intervened quite a lot, but there are some areas and a lot of concerns that most certain part of intervention could not be delivered as expected. Government came with a lot of stimulus to boost the economy in terms of palliative support, in terms of creating job opportunities, and so much. But unfortunately, still you can hear from pocket of complaints that things are not done as expected. And not only that also, if you look at generally, because the pandemic itself also affects socio-religious and cultural activities, that also came up with a lot of reservations. Restrictions were brought so much in terms of religious activities, cultural activities, while some comply and there are still some outcry. You can also see that the country has passed through pressures. The world even passed through pressures. But by and large, if you look at it, the compliance in terms of restricting of major activities that have been seen. We've seen in Nigeria where over 90,000 almost go for every year for Hajj, and this year none of the Muslims in the country can go out for Hajj, and it's still accepted. And if you look at so many people also perform the Eid al-Kabir that just happened in observing some isolation. But generally, if you look at what are the factors that really draw back the actual
effectiveness of
transport, you will know that the economy has gone down seriously, and we are in Nigeria whereby at least large percentage of which I cannot quote a statistic, but large percentage believes or depend on going out today to find what they can eat tomorrow. So that sustained lockdown could not be achieved like other countries in the world. But you see, the nature and God has way of also trying to mitigate, to limit the effect of such circumstances in certain areas that are economically disadvantaged. Even though we are economically disadvantaged, we cannot explain whether, with really scientific fact whether how virulent the pandemic or the virus is in Africa when you compare it to other world. Was it because that we have done enough? Was it because a natural factor, or what?
Have we done enough tests?
We have done
numbers.
Even if we believe that we have not done much like other countries, but in those countries, with or without tests, people are presenting with symptoms. Because there are certain situations when the symptoms comes, whether you like it or you don't like it, you must come to the hospital.
All right, let's look at some of your interactions, especially monitoring this process, the ease of lockdown. And or are you satisfied with the compliance level? We have seen sensitization efforts, even here in the NTA, on daily, on hourly programs and all that, saying, sensitizing the public about it. But in terms of compliance, what is the feedback like to your committee?
Yes, this same question was asked me in this studio by you, and I told you as at that time, the compliance may not be as expected. And I tried to advance the reason. And what are those reasons? It's still going back to economic this time. Because if you want to comply, you need a sanitizer, you need to show social distancing, you need to mask, and you need to avoid cultural shaking and gathering. But these are all economically rated. But by and large, as I believe, and I said, Nigerians are creative. People came with ability of producing reusable face mask, so that if you have one today, you can wash it tomorrow, and you use it. And people are really disemboldened. By and large, the epicenters are the ones that we can say in informal organizations that the compliance is really nearly expected. But if you go outside Abuja now, like other villages market, you find that people still don't observe social distances, and they don't use masks because of the economic need for them to go out and get what they can eat.
All right, so in one short word, let's, before we move on to other aspects, the schools are reopening, at least just in trickles in terms of the exit examinations.
Yes.
Would you say, yes, we're ready to conduct this, examinations nationwide in terms of what you've seen?
You see, in the whole world, no country will say for coronavirus, we are ready. But what the country normally do is to weigh risk and benefit. And in Nigeria, what are the risk? The risk of leaving your children in the house without getting education and being exposed to social harassment, as we have seen just of recent, that the evidence of sexual harassment and abuses has increased because of children are locked down, and then they are close, those who know who are likely to also abuse them without going to school. And the risk of going to school to be likely infected. Now, this is the risk. If you weigh the benefit, you now choose the option. Now, if we choose we are going to open the school, then we should look at that opening of the school to be a responsibility not only for government. We must look at the parental responsibility, the authority responsibility, and also the government. For parents, they must ensure that before they send their children to school, at least basic requirement, at least for a reusable face mask, sanitizer, and then the school should also provide where they can wash their hand, and they should also try to maintain that social distances. And then, for the government must also support the state, especially the schools, especially private schools. The private schools usually drive their funds that they can use to also pay for overhead costs and other this thing. But if you observe over the period for almost nearly 4 to 5 months now, 5 to 6 months now, the school are closed down. So virtually all schools are broke. So the government must also come with the palliative measures. I must also commend states' activities. Most states now have gone far to try as much as possible to fumigate schools, and a lot are doing that. So we do hope that the state cannot limit that fumigation to only public school. They should also extend that same ratio to private school, because the issue is that a child may go and mingle with a child that is also in a public school. So if you disinfect the public school and you forget about private school, then you are not doing much. The chances are that we can have infection that may cross-react during activities that will necessitate them coming together or even meeting in one place or the other. But I think the risk of country maintaining itself in illiteracy, in a static state, especially now that the West African Examination Council could not agree to shift examination based on Nigerian requests. It now became mandatory for us to ensure that we have satisfied the minimum requirement. I use the word minimum because if we insist on having the maximum requirement that is needed, probably we may not open the school. And then we have the issue of this thing. Then we may be challenged in this country with two issues of Boko Haram. One, trying the fiscal, that we can see the actual Boko Haram that are this thing, and then the microscopic one, the coronavirus that we can now also stop us from going to school. So it means we have two dual challenges.
Finally, can you share with us legislative interventions so far to make sure that these processes are smooth and backed by law?
Well, the legislative intervention, let me see, I also belong to Committee on Basic Education of the House, which have received the presentation by the Minister of State for Education on how they are trying to intervene, and all the necessary backing in terms of legislative and budgetary this has also been done by the House. And also, I've mentioned the issue of a stimulus bill that has also been passed. We'll also look at the issue of palliatives, where we have seen, you will agree with me, on many occasions, the House has the cause, and the National Assembly on the subject generally has to call the organ of government that are issuing out palliatives, so that we can think as representative of people who tell the government this is where people are crying, and look at that aspect of it. And we have also tried to ensure that, as a matter of fact, no individual in Nigeria lost his job. And that has, the House has, the National Assembly is doing that and will continue to do that.
All right, let's move on. We started with security. Let's also round up with security. The Progressives Governors Forum has reaffirmed its position not to relent in supporting Borno State in its